Good morning, everybody. It's Dr. Galvin with another update, not about COVID today. Today we're talking monkeypox. We actually had our first case of monkeypox up here in Rowan County where I work in the emergency department. Didn't actually see it myself, but we did have a case that was reported. What's monkeypox? It seems like it's the World Health Organization just declared it a public health emergency. What is it? Well, monkeypox is basically a virus. It's very similar to the virus that caused smallpox. Now, smallpox was a very deadly contagion, was completely wiped out from the world in 1980 by a mass vaccination program. It's the first virus that's actually been defeated by a vaccine. Monkeypox, though, is similar, not as transmittable, certainly not as fatal, but there's some concerns that if it gets transmitted enough, like we're seeing with COVID, if it gets transmitted enough, there's a potential for it to mutate to a much more severe form, and that's one of the concerns, that we don't want it to really spread around. We had an outbreak back in 2003 in the U.S. I think there were 47 cases. Now, worldwide right now, there's over 16,000 cases, so it's more concerning. What are the symptoms of monkeypox? What kind of typical viral things? Fever, body aches, headache, things like that. But the typical thing with monkeypox are these pus-filled lesions. Most people get multiple lesions. They can cause scarring long term. But there are reports that people may only have a single lesion that might, fool people as it might think it's syphilis or another sexually transmitted disease instead of monkeypox if you only have one lesion. So you have to be aware of that. The rash lasts for about 2 to 4 weeks. Very high survival rate, very rare to have any problems. The people that may be at risk are those under 8 years old, children, breastfeeding or pregnant mothers, or people who are immunocompromised. So we have to take special care with those groups. The most common long-term side effect is scarring from the rash. Very rarely there's some pulmonary or eye manifestations of it. The risk of contracting it is low. You have to have direct contact. So we're seeing a lot of it being sexually transmitted because it can be transmitted by saliva. We don't know if maybe it can be transmitted by other bodily fluids. The other things are very tightly packed gatherings like a rave or some kind of mosh pit type thing. I don't do much of that myself anymore, but if that's what your thing is, you got to be a little bit careful. The treatment is typically isolation. You've got to be isolated from other people for a week or so. There are some vaccines for it. We have 2 current vaccines that are used for it. They really need to be, they're vaccines against smallpox. Not very available, but probably more will be available as time goes on. The other hard thing is testing. Testing is difficult to find and access right now. That's probably the biggest problem, and hopefully we'll be able to expand that with time going forward. But that's a quick overview of monkeypox. Would I worry about it in my daily life? No, but if you are feeling sick, you start getting these weird rashes, probably need to talk to your doctor. Whether testing is easily available, may need to be done through a health department or something else. I think most of us are at low risk. Again, there's not that many cases worldwide, but the concern is that if there are a lot of cases, and those cases are growing, it could turn into something more severe. I'm Dr. Jeffrey Galvin. I'm a board-certified emergency medicine physician, also run a precision medicine clinic in Charlotte. I do these updates typically about COVID, but today we're talking monkeys and monkeypox. Have a good night. Everybody stay safe. Talk to you soon.